eminent panelists, Dr. NachiKet Shankar, Professor of Anatomy and MU Co-Convenor, St. John's Medical College, Bangalore. And we have Dr. T. Mahalakshmy, Additional Professor of PSM, Co-Convenor of NMC Regional Center, JIPMER, Puducherry. And we have Dr. Narendiran Krishnasamy, Senior Lecturer, School of Medicine, Faculty of Health and Medical Sciences, Taylor's University, Malaysia.
Okay, good morning, everyone. So, this session, we have planned it in such a way that it is as interactive as possible. We have already circulated a Google form and we have received a lot of responses. So we look forward to a very productive, very interactive session. So I think the panelists have already been introduced. They're all eminent persons in their fields. So the thing is, why this topic? Have things changed? In which ways have things changed? So there has been a lot of reforms in the way medical education is seen these days in India in the recent years. In addition to that, there's a lot of advances in educational technologies, in medical science, as well as the students. There has been a drastic change in the way the students think, the way they learn. So this is a very important and an apt topic for discussion. So I'll just give a glimpse of what responses we received since morning. Not unsurprisingly, most of the responses were on attention span of the students. So they have a very short attention span and their concentration is somewhat impaired, and what to do about it, how to go about it. So that was one of the most common responses. And then there were others. We'll take all those for discussion. In addition to that, we have circulated another Google form, the responses of which we'll be projecting and also we'll be taking for discussion. So this is not only us, so the panelists, like the entire audience. So please feel free to post the responses there on the Google form, and if you feel like, please take part in the discussions also. So shall we go ahead? Okay. So we'll come to the hot topic, that is the lack of attention span of students and how do we gain and sustain their attention span in the classroom. When you say classroom, we are going to include the lecture halls, the practical halls, as well as the clinical or community settings as well. Okay. So may invite response from Dr. Mahalakshmy.
So it's easy to start first. You can tell your opinion. And so when we're thinking of the attention span, yes, we all are facing this current problem of attention span, and we also know the solution which has been discussed, like engagement, student engagement. But the issue which we face is having a huge group of students, and how do we engage? So when we're thinking, when we're discussing in the group, we thought of three types of engagement we usually do. One is this, there are three components. One is the student, instructor, and we have the content, educational content. So one sort of interaction which we could encourage is between the student and student, which we commonly use is the think, pair, and share. But the issue comes in when they come to share. How do they share the contents when it is a large group? If at all we are asking to share, we share only with few. We ask only few students to share. So what we generally, I think many people also use it for people who are not using, like we send a Google form or a QR code in which they can scan, and when it comes to sharing, they share it through that Google form or Google, a Mentimeter or something like that. So it becomes very visible to the student. And the other thing which we're thinking of, student is, and the content. Student and the content, yes, attention span is decreasing. And where is the attention going? The attention is going to their smartphone. So what we are thinking, why don't we use it as a thing? So we could include a small thing on Google it. So in community medicine, what we do is usually the national programs are available in the free domain. We ask them, okay, what is the current changes? Recently a document is released. Google it and tell the salient features as a group. So that way also we have a student content interaction. Student teacher interaction, yes, that's the biggest challenge. So what we try to do is to have peers, student and teachers. Instead of teacher, we have a peer group being discussed, in which the peers become, because as a student, the more thing they wanted is a more of belonging in the group. So a student peer, so in the peer they become accountable. They may not be accountable to us in a large group. They are accountable, but it somewhat reduces. But when you give a group activity, they are accountable to the peers. So in that way, there is some sort of engagement and thing. These are few points I felt would be relevant. I think over to you, sir.
Dr. NachiKet, if you want to like that.
So thank you, ma'am. I think you brought out those three elements, that is the teachers, the students, and the content, and you looked at the interactions between those three in pairs. So I think that's a very nice way of looking at things. The point that I wanted to bring out was relevance. I think if the students feel that whatever is being learned is relevant for them, then automatically their attention span will increase. So I think the relevance is another important point that I want to bring out, and there are many ways of bringing out the relevance of a particular topic. And I think the easiest way would be to sort of look at how they can apply that content to their future, in their future practice. So that's the point that I want to bring out. Yeah, thank you.
Dr. Narendiran, would you like to say something about it?
So I remember one of my teacher who taught me, it's not during my MBBS time, when I started off while working in anatomy, when I started off, I left the country without a master's, and I was put in anatomy as a curator, and that's how I started my life. And I still remember one of the words that one of the lecturer who taught me, one of the teacher, I would still consider him as a teacher, he's in Manipal still. He said, whatever is under your control, you do what you have to do. If you can bring a change and that change is within you, you can do it. Others, you don't bother, things will fall in place. This was my motto. So I'm very good at blaming people. So that is when things changed. I said I have to change myself if I have to bring in a change in another person. So if I have to bring in a change, I'll have to make them feel or connected to me if I have to do that. So connection in the sense, I still remember I was talking to one of the gentlemen here. We had a microbiology teacher. We had a huge lecture hall which had about 149 students, and the dais was this long and a blackboard from end to end. We had a microbiology lecturer who did not bother whether he has the slang. He did not bother whether there was any grammar in his language. He wanted to teach antibody-antigen reaction. This is the language. Antigen, antibody, antigen-antibody reaction. This still lingers in my mind. There was another anatomy lecture, middle ear. He said, this is your middle ear. This is the superior part. This is the inferior part. This is the lateral part. This is that. Like that he went on. Another thing, if you want to teach, I'm going back to the anatomy again, urinary bladder, ultra difficult sometimes to understand superior surface, apex, lateral border, inferior lateral surface, inferior border, posterior surface. Equate it to something that they are used to. So what do I say is, it looks like your toilet closet. Close the lid. Now observe it from the sides. That is your urinary bladder. The closed part, superior surface, the edges, like that, if you can equate it to something that is into a day-to-day life, the attention span is very high. If you can bring it, that intent, that emotions that you had seen. Let me take that example right now which happened with you, madam. I saw some tears yesterday when you thanked. I saw some tears when you just said thank you. I don't know many had watched or not, but I was able to see that you were wiping your eyes off. Probably it could be a dust or the tears. I don't know. There was a lot of emotion in it. I don't know whether you felt that emotion or not. I could feel that emotion. That is what I'm trying to say. It could be tears. It could be tears of maybe they would... It doesn't have to drop. That is the passion that I'm saying about that can make a difference. Given a talk, I'll keep talking. Sorry.
No, I actually brought me a memory of one of my teachers who used to dramatize everything. So we would raise a voice like even those who are sleeping will be awake and then have to listen to what's going on. So that is what I don't think everybody can do it, but whoever can do it, that is one of the techniques, a simpler technique. So is there anyone from audience who would like to add? Yes, Dr. Mahalakshmy.
Actually, Dr. Mahalakshmy brought out very nicely that the teacher, student and the content. See, when we have an engagement which takes place with the audience engage with you as a person, right? The emotional component or how you conduct yourself and the way you joke and the way you talk, all that makes a difference. but it also matters what is the content, how you are engaging with the content. So if we can make one is relevance is one aspect of making the content engagement with the student better. But we can also use technology very, very effectively for this engaging with the students. Our simulation, that's why it is actually picking up so well, because they have a real engagement with what is going on in that thing. So teacher, content, teacher, student, content, student, student, student. So this is the triad which is going on in the class, and unless we understand the dynamics which is going on, it becomes a little difficult.
There is one thing that we were discussing, I thought it will be relevant to the local context. There is this lesson that I learned from a New Zealand English teacher. There is something called visual literacy. Madam was saying linking the content to what you're trying to deliver. Suppose, for example, if you are teaching cranial nerves for today, it's an examination of cranial nerves. You put those in the form of a picture. You don't give them a real picture. You give them all funny pictures that are related to the concepts of cranial nerve examination. And it has to be in all directions. It does not have to follow a pattern. If I read it like this, I can read through everything. Let it be upside down, turn to an angle, tilted to the left, tilted to the right. This whole group is there. Last 3 benches, one group. Middle group, another one. The front is another one. Like that, you break them. Throw one picture to each group. Give them 15 minutes of your beginning, of your first to start with, but prior to that you will have to give them pre-reading material. Let them, those who read, let them read. Those who don't read, never mind. First time, second time, third time, slowly they'll get engaged. With that content pre-reading material, if they can go through that, it will work, which is called visual literacy. Give a choice, it really works. The word is called visual literacy, where you put all your content, equate it to certain kind of images, let them read your mind. Ask them to bring all the content that they want to the class. Let it be the handphone. So let them use their own handphones. Let them use the internet facility that's available. Try to read your mind. They will be able to touch the content. Visual literacy helped me a lot. If you want, I don't have a picture of it. If you can look into internet, what do you mean by visual literacy? You can define it the way you want it to deliver, which can be very personal to the content that you have.
So do you mean to say that like we show a picture or we ask them to search for something during the class?
Create that. Okay. You create the picture.
Okay.
Put multiple things. Suppose we have 15 slide content related to it.
Okay.
It has got about 50 words. It needs to put 20 words in. To equate the 20 words into a form of a picture. Page 1, this is the picture. Page 2, this is the one. Let them equate the picture to the subject content that they have. So which is a different way of doing it.
Okay.
That is also another way that you can.
Okay. So like Dr. Mahalakshmy had pointed out, like students, they like suppose there are 150 students in a class, everyone comes with at least one device. I mean, be it a smartphone or a tablet, and we very often see, in fact, in one of the lecture halls, there are cameras fitted, and we saw that some of the students sitting behind, they were all having their device in the hand, and they were actually distracted, and they were doing something else. So it is very difficult for us to control, and one of the parents asked during the admission this time, asked, are you going to allow tablets inside the hall? So they wanted students to have tablets inside the lecture hall, and also students were also very apprehensive whether it will be allowed because they want to take notes. So we cannot be restrictive, but how can we use it in a constructive manner? Any suggestions? It's like they are going to have a device in hands, all of them.
Okay. Actually, one thing which we tried is like for the students' attention also, which helped us. Now the concept of concept mapping, and as a thing, even in the concept mapping, they use visual thinking, where they put the concept in terms of a diagram and keep it, so that it stays for a long time. So what we used to do is, after a 10-minute class, what we do it as a note-taking pair. So along with the student who's sitting adjacent to them, they form a pair or a group. And after 10 minutes or 15 minutes of a class, we give a break for some time, which they can draw a concept map. And the students already have their own classroom groups. So once they make a concept map, they take a picture of it and share it with it. So that's one simple thing which we felt would be useful.
So, yeah, thank you, ma'am. So I think your second question is about devices, right?
Devices.
The use of devices. So I think we'll really be in denial if we sort of prevent students from using devices in class. So they're going to use it whether we want it or not. So I think we can use it as allies, and we are using devices, right? So I think in this hall right now, probably 10% of you are looking at your mobiles on some WhatsApp or some other messages that are coming. So I think it's a very powerful tool that we can use, and I think if we restrict the usage, then students are naturally rebellious. So they'll tend to use it for other purposes. So I think we need to be imaginative in the way we sort of use or allow students to use these technologies in teaching learning activities. Just as an example, in the dissection hall, we allow students to use mobile phones because we suggest certain apps. There are some wonderful apps that are available to visualize the human body in different ways, and you can rotate and get different perspectives of the human body. So it would really be a waste if we don't allow that beautiful technology to be used by the students and teachers in order to facilitate learning. So I think we really need to be open. And the second point that teachers often bring, some of them, is that they are looking at other things, not realizing the fact that whether we use devices or not, 20 or 30% of the students are not listening to what you're saying. So using devices is not something that is going to be a disadvantage in that regard. So these are some of my thoughts on that.
Can we say that like we can bring in those 20-30% of the people into the class by engaging them in with the help of the devices?
Possibly.
Okay. So like at this juncture, I would like to ask someone in the audience who have used technology during class to bring or to sustain the attention. I see a hand there, multiple hands. So can someone pass on the mic? Thank you.
Using technology, on my point of view, we come across as a student, now we are here. The psychological preparation of the students is important steps to avoid this, whether you want to bring the whatever electronic can get inside. The teachers are very good. Even though suppose we have across many units in the medicine surgery, if a good teacher, our attention will be there. So no need to go for, I'm against the using this electronic device. I see one more.
Sir, actually using the mobile devices, now recently we have started our students instructing them to use the mobile devices. My question is, will they become a Google doctor in future? So anything we ask in any of the classes, just they go to Google and search. They never go for textbooks. They start using it, and surprisingly latest what we have done in our institute, a survey among the MBBS students, they got nomophobia. Around 90% of the students got nomophobia. Once you seize the biggest punishment what you can give to a student is if you get their mobiles, if you confiscate their mobiles, they'll be behind you the entire day to get back their mobiles. So this is how they get addicted, and are we pushing them towards the scenario of Google doctors? So that is from my point of view, I just want to ask.
When we say Google, can we not suggest them some authentic sources where they can go and check? Maybe suggest a few sources where they can check and get authentic information.
This is the same problem what we are also facing. See here, just now sir give an example that in this hall 10% of the people are already using mobile. But 10% what they are doing is important. What they are doing, they are listening to your lecture and they are seeing it, or they are watching the WhatsApp. So ultimately that 10% viewers are not in touch with the surroundings. So can it be something like this? You can allow the technology. The day may be started today. It may be worsened. 100% when technology comes, it has to be started using it. Can you confine to this devices timing? So you start everything without devices. I give them a time about 10 minutes, 15 minutes device time, and ask them to react with that. I think that would be better rather than generalized this one. This is my view.
Okay, how we use it? Student comes, normally it takes 10 to 15 minutes to take attendance. We send them a Google form, name, there's something, and one code is written on the blackboard. The amount taken to take attendance of 150 students is about 90 seconds. So those 10 minutes are saved. Then we start our presentation. We start with a Slido thing, which comes, Slido or Google Form, both are available. So they answer a question from the previous lecture, 3, 4, 10 slides later on, we ask another one, we use Mentimeter, we use, there are other now facilities in which we interact with them constantly.
Right.
Then at the end, we take another test right on their mobile phones, and the results of which come on the screen instantly. Then
that is feedback.
Yes, a feedback and how many understood. Then we divide the class into different parts depending upon those students who answered it in one certain portion of the test in a right manner, a certain portion which divided into wrong manner. So depending upon the distractors which they chose, so we divide them, and then we instantly the software creates a curriculum map. So that curriculum map is instantly available with technology, and these students are asked to read this part, and in the next batch they come. So the amount of time which we saved from attendance can be used using this curriculum map.
Sounds fantastic, sir. So I'll take one more
good morning. I'm Dr. Karthika. I am a faculty in the Department of Physiology. So since we deal with like really young students, they come for the first time to the professional college, we usually have more than one teacher present in the classroom during a lecture. And most of the time from our department, we try not to make it a complete lecture. And we try our best, as Sir said, we try our best to make technology our ally rather than a foe, because whether you like it or not, the kids use technology, and we have to accept the fact and move on with the current scenario, because we use it a lot and the kids are even well versed more than us. So we need to actually use it to our advantage. So as Sir just now said, we use the same thing for attendance. We give a Google form, we use that for the attendance, and we give a pre-test, we give multiple feedbacks. We get multiple feedbacks during the class and even towards the end of the class as a post-test. And since we have more than one faculty member usually present in the lecture hall, when we get a division of the students, you know, they're understanding concepts, okay, one batch or one set of students have not understood something. So we have the opportunity to divide the teachers amongst ourselves to go to one particular group of students, clarify their concepts, etc. So it becomes a very important tool. We use it very occasionally, we use it very frequently. And we insist that all the students bring their phones to the class to every lecture, for our department. And we insist that they have internet facilities.
Right. So that is very similar to what Sir had spoken. So you identify people who need maybe like more explanation, or they have to work more on a certain area. So that is taken. Thank you.
One last, can I just add? Yeah. I'm from the Department of Community Medicine, and as Dr. Mahalakshmy also mentioned, we do use technology a lot in our sessions. Specifically when we are in the community and we are collecting data, we use technology to collect data, getting rid of papers, and and it's easier for the students to also learn how to collect data as well as analyze it and present it. So presentation, graphical presentation, all that they do. That's been going on for a long time. But one particular thing I wanted to share was that we used, like Dr. Sanjay said, we use Mentimeter as a part of assessment at the end of a few sessions, ITP and all that group activity. And the students really enjoyed it. We had a quiz. We had few rounds of 5 questions for each particular thing. And the students, all of them, they were given that code and they could take it on their phone and respond, and they had their own names, different names. Some was one person was a Batman and somebody else was a chocolate this thing. So they could answer and they could see who was actually doing well, and we got a feedback how many of them were able to understand. After the session, they actually asked us, Madam, next class will you have the same thing? We would, more people would come. So next time also we had a better attendance, and students were more attentive during the sessions. I personally felt that activity was very successful for us.
Okay. Thank you very much. It is exciting to see that there is a lot of participation from the audience.
I can give you some experience from the place where I come from. We were forced to abolish 60% of our lectures. Our classroom is not lecturer facing the student. Student back faces the lecturer. Our classes are not like chairs. Our classes are round tables, and each round table will be connected to a TV, which is like this to the wall. And there is an activity related to the lecturer that is going. If the lecture has 5 different outcomes, each of it is given to 5 different groups. Each of them work on something, and each of the work is displayed on the TV. The silent fella, the fellow who is very vocal, everybody is supposed to contribute. And the lecturer goes around. Everybody watch what is on this TV. This is the first learning outcome. What do you think about it? Why did you do that? They have to come out with an answer. Whoever is kind of speaking the most, we will tell them, okay, can you give the opportunity to another fellow to convey? Probably we will tell them, if the person can't help the fellow, if you can't speak in English, come out with a local dialect. Nothing wrong for the time being, as long as blood-brain barrier, things cut across, things are fine. So this is called X-Space. Just give it a try if you can change something.
Thank you. Dr. Dinkar.
Yeah, just to be a little cynical, I think the whole discussion to me is moot. And the reason for that is we are talking about engaging learner attention in the classroom. I don't really believe it depends upon whether you have technology with you or whether you don't have technology with you, whether you allow them the use of mobile phones, whether you don't allow them the use of mobile phones. I think it depends upon the enthusiasm of the teacher. All the solutions that we have heard using technology ultimately have one thing in common, and that is the innovation exhibited by the teacher. It is the enthusiasm shown by the teacher. And even without technology, the teachers can do the same thing to develop that enthusiasm in the student. Whether you allow them the mobile phones or not, if your process doesn't change, the students who are not going to be attentive are not going to be attentive. Just because they've got the mobile phone in their hand, you don't know what they're doing with it. And if you ban mobile phones, by the same token, those who are not going to be attentive are still going to be sleeping at the back or pretending to be attentive, and that they will be wide open but practically sleeping. So I think the discussion overall is not about whether we allow technology or not allow technology. It's about how we as teachers make the classes more engaging so that the students automatically that we get the learner engagement. Thank you.
Thank you, sir. So the idea is it's not that technology is going to replace the teachers, but anyway technology is there, so how to make best use of it. So that
sorry.
was...
Can I just...
Okay.
Sorry. A lot of discussion has been going... I'm Dr. Anupama. I'm consultant psychiatrist. So the only way I get to interact with undergraduates is time management, stress management, emotional regulation, all those other things that are not covered in the academics. So my personal experience as far as technology is concerned is, I am really sorry to say this, but one of the classes that I recently took was emotional regulation, and one of the things that I want to assess pre and post assessment was whether they understood the primary simple concept that there is something called a primary emotion and a secondary emotion. So secondary emotion is emotion of emotion. It's emotion of the primary emotion. So now I've given them a simple scenario and I've asked them to identify which is the primary emotion and which is the secondary emotion. And the first time I took the results, I took it in the Google form, and the answers were copy pasted from Google. They did not write their emotion. They copy pasted what is the definition of primary emotion and the definition of secondary emotion from Google. So now I have abolished for assessments as far as it's subjective. So here I am connecting what Kadambari ma'am has been talking about in morning, context. What you are assessing matters, and it matters whether the answer is readily available in Google and you don't want that answer. Thank you.
Thank you very much. So There was one pertinent question in the response that we received in the morning, that students prepare for their NEET examination these days in coaching centers, most of them in coaching centers, and the way they learned and how they prepared for the entrance examination is quite different from how they have to learn during the MBBS course. So how they find it very difficult, particularly in the first year and then on also. So how do we help them, like how to go about it? So Dr. NachiKet, like.
Yeah, so I think that's the reality and we need to accept it. So I think I was chatting with people, is the concept of the Indian medical graduate a myth? So I'm not sure. Perhaps in the minds of most students and many teachers, it's just a concept and it's not something that the educational process encourages. So we need to really take a relook at the concept of the MBBS program being a program to train graduates to become the Indian medical graduates to address the primary healthcare needs of the nation. So that being the case, I think we should not become cynical. I think it's important to reinforce the fact that they are in medical college to become the Indian medical graduate, right? Till such time that the NMC changes that. So I think that's one thing, the constant reinforcement. The second thing is that I think faculty members themselves need to believe that that's the purpose of medical education. And there's a concept called strategic learning. So you have superficial learning, deep learning, and strategic learning. So a superficial learner just learns to pass exams. A deep learner learns for the sake of learning. And a strategic learner is able to balance both. So they're able to sort of do well in the exams, at the same time sort of go into concepts. So maybe we should focus on strategic learning, and we should be cognizant of the fact that students are going to go to coaching centers, but over and above that, in medical colleges, we need to keep reinforcing the fact and convincing ourselves that we are training the students not only to pass the exams, but also to become the Indian medical graduates. So I think there needs to be that mindset amongst teachers and students as well, and we need to constantly reinforce that in our day-to-day teaching and learning activities.
Talking about the mindset of students, these days students have their aim has been to somehow enter into medical college. Once they enter, they feel like, okay, now it's the time to explore other things other than studies, and also their look at life is slightly different. The way they approach life is different. They want more freedom, they want say in everything. So that is something with the new generation we are seeing. Dr. Mahalakshmy, would you like to add?
Actually, this is relevant to one of the student who came to when they joined in the first year, just recently, 2 weeks back. The student came and she was mentioning that till 12th, my parents were telling, like, once you clear it, yes, it's done. After you enter the college, you come out as a doctor only. So now, and also with the foundation course and all that, even though in foundation course we tell about the Indian medical graduate and other things, but the student was, now is the time I want to explore extracurricular activities. Now is the time, because I've been stressed till 12th to go into with only one focus on going into the thing. So now, and the other thing the student told us when I was going to the coaching class, so from 8th, it's whatever is taught is enough. I need not go back and read. Whatever the concepts are very clearly explained, and whatever the thought is enough. Now I find it difficult that I have to go back and read. What is given is a glimpse of it, and I have to go back and read. These two challenges the student came up with. What we could think of is like call the student 2 or 3 times and interact with the student, and also tie up with our own PGs who are able to tell them about their experiences, how did they go about, because when they connect with us, our era is totally different, and the way we prepared for entrance or something is totally different. So we had to connect with their own senior group or JRs or something like that for them to interact. And other thing, actually the student told us when they asked to write the foundation course assessment, the student told that I'm unable to write. I know all these concepts, but I can't write an essay question. I have lost touch in writing an essay question from 8th. So I cannot do that. So that's again written part which has to be a little more emphasized. We all talk about oral communication, but written communication becomes important even as a doctor or something. So that then we little bit scrapped off community medicine record book. They have to write 3 records. Then we saw that students are just copying. Then we reduced the record, the number of records. But now looking at the students, we are rethinking, can we have a record in a little different way so that they develop written skills. So that's something which we felt recently.
Okay. Dr. Narendiran, is the scenario different in Malaysia since
very much different? We have the autonomy to make our own content, and the council comes and evaluates your content to say whether it is applicable for a medical graduate or whether it is a person who is graduating as a patient-safe doctor. That's the simulation word that we use. That's what they are looking at. Do they have all the content that is needed for them to be as a houseman at the end of the day? It's the medical council who will come and evaluate your content. If they say yes, you can start your program. They come and monitor once in a while to see whether you are running the program as it is stated in your document which has been approved by the council. Number 2, since we have the autonomy, at one point in time, a lot of students wanted to go abroad, and most of our learning outcomes were subject-based, topic-based learning outcomes. We moved the higher order learning outcomes so that will help them to get into the competitive world of getting into any form of examination. So that part we were allowed to do, and it is a long exercise we are still going through. We have modified the curriculum twice since 2011, and one has been approved right now by the Senate, and we are moving forward with that. And ours is like, none of it will say apply basic knowledge in relation to something like that. Using the basic knowledge, everything goes back to the clinical touch. So right from year 1, nothing is described, list, nothing, all are abolished. It is higher order kind of a questioning. Learning outcomes are defined in such a way so that they can go into any form of competitive examination. Whether it can work, I'm not very sure in the local setting.
But that is what is the need of the hour. Students right now are just focusing on rote memory. And even those concepts which are to be understood, they just memorize from some textbooks and then they try to write in the examination. So developing higher order thinking is the need of the hour, particularly in this scenario. Shall we project? So we have got some responses from the audience, they've asked some questions. Okay. So one is internal assessment is a drawback. How to tackle? Okay. So how are we satisfying the recent Gen Tech savvy students by TL methods? How far it has evolved in terms of evaluating? I think we had some discussion on that. I think we answered most of it. Teachers and students both have access to all subject content online. How to overcome this as a teacher? Dr. NachiKet.
Yeah, I think this is very important. So I think are teachers content providers? So I think that's the question that we need to ask ourselves. In the past, I think what the teachers said was the gospel truth. So the textbooks and teachers were the only available sources of factual information for students. But now, actually, it's a fantastic thing. So, for example, if I go and I have internet access, I have access to the world's libraries, right, which was not possible. Thousands of journals, thousands of books, thousands of websites. So I think that's an advantage, right, in that we don't now need to focus on providing content, but focus on the application of how that content can be used. So we can use 90% of our time on application-based exercises in classrooms and labs, etc. So I think that's a huge advantage for us, that we don't need to now focus on provision of content, but rather on how that content can be utilized in a clinical context.
Thank you. So these questions are open for the audience as well. So if anyone has any opinion or any point they want to make, they can raise their hand. Thank you.
Good morning, one and all. I'm Dr. Sangeeta Raja, Associate Professor of Pharmacology. And I just want to share my experience. both using the gadgets and without the gadget, how to grasp the attention of the students. So this was for a class. I made a lesson plan. We used to have a memory game where you need to tell one object name. The second person has to add the first person's, and then he had to add one. For example, for my subject, if it is gentamicin, the second person has to say gentamicin and streptomycin. The third person has to say both and add one more. So it goes like that. So then it piles up to 20, even 21. So this I used for the classification for my students. So randomly you pick one student and ask him to say the drug, and then you pick another person who has to add the first person's drug name and the second name, and likewise. So in that way they tend to revise the, because classification of the drug is a dreadful thing. The second thing is you can put, I just put the drugs on the screen, gave them 10 seconds to grasp it, and then shut it off and ask them to name the drugs which they could remember. So in both these ways, the students were very attentive, and one thing is I just made them to learn the classification kind of. And using the gadget is the Kahoot app, which I used to give before the beginning of the classes, so to judge as a pre-test as well as after the post-test. That was also helpful with the gadget. There are many stalwarts here, but my opinion is now is the era where we have the knowledge. Previous era was we were gathering the knowledge. That was the primary most thing. Now is the era where we have to teach them to apply the knowledge which they have, because knowledge is available everywhere. The point where the teacher comes is at how well to apply the knowledge which he is getting for his development. So that is where the teachers now stands. And thank you for giving me the opportunity.
Okay, thank you. So the next question is on
span. I would like to say something. So usually when we go to a class, the learners are already fixed with the previous class because they had some discussion in the previous class, and probably they are thinking about something which is going to happen in the future. So always start with the past. Don't go to the class and immediately start talking about your content. So what you have to do is like just give a pass, try to develop an eye contact with everybody so that everybody comes to the present. So they know that, okay, so now I'm going to listen. So, and most of the students are not attentive because you keep doing your job, you keep taking your class or lecture or whatever. So at sometimes in between the class also, if you feel that there is so many people who are not attentive, so in that case you can again give a pass. So maybe try to, everybody thinks like, okay, when there is a pass, then everybody thinks, no, they focus on the teacher. So something is happening because they are doing something else because that you are doing something and they will be keep doing something. So, and again, usage of gadgets, definitely, we cannot avoid. We have to include, and as they said, like voting, opinions, and multiple apps are available. We have to involve them into that.
Right.
And finally, like talking about the 10% and the 20% who are getting distracted through the devices. Let us not focus more on them. Like I see most of the teachers get distracted because of this. They get distracted, and then those people, the 80-90% who are listening, they don't get the content because they are worried about the 10% who is not listening or who is not attentive. And probably like you can talk to them later, and if you find that there are some people who are regularly not attending to the class, maybe they may have some other problem, you have to talk to them. You can even ask them like, how do you want me to improve my class so that I can improve, I can get your attention. You can even ask the student or the learner like that. So I think this will help. Thank you.
Thank you. Thank you. So one of the other point raised was the time available in classroom. So a shortage of time is there in the classroom, but and Dr. Narendiran was saying we reduce lectures in the classroom and make it more interactive, make it more this thing. So how can we involve them more beyond classroom, and what are the different strategies?
Start. You can pre-record your lectures, give it to them. Zoom is free. 45 minutes is the time that has been given to you for a free component. Pre-record it, give it to them, give them all pre-reading material during the class, convert it to the way you want to. If it is a large group, if you have like-minded lecturers in the same department who would like to share the class with you, divide them into small groups. Each of you all have the same guide that you have to follow for that particular class. Let them be the facilitator for the day. It will work out. That's one.
Okay.
We, in one of the conference which we had, medical education, we asked one of the students to share his journey on MBBS. He wrote a beautiful statement that I still remember the statements put forth in Ottawa chapter, because that was given as a self-directed learning to me, and I enacted a skit on it. So this was actually, Ottawa chapter is something very abstract, and a student remembering it was not a big thing for us. So some components of the teaching content, like non-communicable disease, was something which students can do at their own pace. So we had given the chapters prior, and they had prepared their they had their own skill. Actually, they took a better session than us, having a formative assessment and including giving the pre-assignment, since it is their own peers who are giving a pre-assignment. So there was more contribution from the students also. So they came prepared, and it was like there was a knowledge as well as an emotional component, a lot of fun and other things. So both these things became a long-term memory, or a change in their skill, or change in their practice. So this way, I think self-directed learning, though the NMC tells self-directed learning is given and we have to assess it, but we can give the students some group activity. They do it at their leisure time and come and present the presentation. They can have as one of the practical session, they can come and do it. So that way it was more engaging for the students.
So actually regarding, as I was talking about like recording a video, honestly speaking, I cannot see, I don't watch a video if it is more than 10 minutes. So that is one problem. So we may make it into small. These days it's the day of shorts, YouTube shorts and Insta reels, which spans about a minute. But if we can pack the content within that short period and make it into multiple such tiny videos, I think that may be of help. But how do we know whether they have gone through that or seen the video unless we test them, that like assess them? So that also, are there any ideas like how to do that? So I see a hand there. So you would want to add something?
Myself, Dr. Shamim. I'm a dental faculty. I'm from the Department of Prosthodontics from Sri Venkateshwara Dental College, Chennai. So what we have done for this particular situation is that we have created an app wherein we register all the metrics as to how long the students engage in a particular lesson. So if they are weak in a particular topic, we get the metrics as to the time frame, as to how much the student spends in that particular topic. So we can go back and get the analytics with the help of the app. So this way we can use the technology. The teacher will become a facilitator here by using this kind of a technology. So going forward, we can take the apps to all the medical as well as the allied sciences as well. Thank you.
That's a great point, because we can identify slow learners or learners with problems early on in the course itself.
Technology is working much more. They are far more advanced. Only thing is we are uncomfortable, or we do not use it to the maximum potential. For example, when the COVID struck, everybody was using Zoom, everybody was using Cisco. So the Cisco, the paid version of it, it came with a thing, how much time people were engaged in looking at the screen and how many of them had the other windows open. So this is available as the back-end data, provided we knew how to look for it and when we were doing that. So actually it is available. For that you were asking about analytics, right? Canvas has this very beautifully in the LMS. So it says that each video, how many of them have watched, how many of them have watched at normal speed, how many of them ran through the video, how much time was spent by each student on each of the modules, and what is the assessments taken and things like that. So it is that back-end data. Only thing is we get a little scared by technology. The moment we say, to us technology in the classroom is Google form, and if we are little bit more experimental, maybe Slido or Mentimeter. But actually the potential of technology is much, much more, which we need to kind of harness. So these are simple examples which happened. So we could actually see how many fellows were there watching the Cisco class and how many fellows had multiple other windows open.
So I think that's a good option on Canvas. In fact, if the students know that they are being monitored, that teachers can see how much they have interacted with the course, I think that gives them feedback that they'll want to do it. Yes. Okay. So yes.
It's again a Malaysian concept.
Multitasking, sir. Maybe having all the. We have two different, one mobile and one phone. I am having capacity to observe from all the things. I can grab everything from all the gadgets.
Okay. There is another one that we have, which we call it as LMS. I think many university has that. LMS. That has the potential actually that you can design your lecture, what activity that needs to be done. If you want to progress from one area to another area, you should have done some task. It's a one-time daunting task, daunting to the power of n. If you can devise that, they will have to go through, or else you will not know how much. It's like, you'll have to be very strict with them. That is how we function actually. We tell them if you have to move on from one module to another module, you should have gone through that. If that can be transferred into the LMS based on the content, so that they can go from one step to leading to another step, you can always control that. And each step, if it can be converted to a part of your continuous assessment, it is going to work. I still come from the old school of thought where assessment drives learning. Before and all, people said assessment doesn't help. Assessment still drives learning, nothing wrong, but what type of assessments? It is just not continuous assessment can be many things. We have moved on for 80% theory, 20% continuous assessment to 70-30. That is a standard. It is a university norm, and our university is still, the medical council is not ready to accept it. We are still fighting it out. And if you look at it, our assessments are, every activity that they do in a class is an assessment. We have a rubric for it. Everything is designed and kept. And this is what is being done here.
So another rather comment is, I think it's an impact from Professor Kadambari's talk about neo-colonialism. It's about whether we should give up our traditional methods to the newer methods. Probably we should have both. I think we have moved past. Okay. Okay. So is there evidence of peer-to-peer learning working in our context? If yes, what are the factors to be kept in mind to work? Peer-to-peer learning is also another important tool. So
I think we are running out of time. Maybe this is the last question. Maybe we can give it to the audience. So would any of you like to share your experiences with peer-to-peer learning, please?
I think a lot of discussion has gone on, but content is one thing. Second is the emotional contact between the teacher and the student. You must be remembering our old students who are more emotionally connected, and we follow them because emotionally they're connected. So there are two issues. One is the content, second is the contact between the teacher. So we should try to establish good emotional contact with the student. Second point is that we are talking about using gadgets. I don't think there is anything wrong in using the gadgets, how well we can use. Suppose you are talking about the formative assessment, continuous assessment. If you connect your session to a assessment, then probably he will not do other things. He will carefully listen what you are doing. At the end, you are going to give him a feedback and assessment. Other important point is now NEET next, so many exams are coming. His object is not passing MBBS alone. He wants to do MD, MS, DM. Already when he is joining, if you ask them, they will tell, I want to become a cardiologist, I want to become a neurologist. So our selection method also should change with the time. if your object is making a MCQ and getting PG course, that is his aim. So he will not sit in your class and listen. He will go for contact classes or coaching classes, and he will try to get good marks in the entrance. So one of the problems may be that we have so many medical colleges, so many seats in the undergraduate, but when you come to postgraduates, the ratio is markedly reduced. Suppose it may be 1 in 50, I don't know exactly, but number will be much less. So many students have to compete to get one seat. So they will aim for that. So the outcome, if you look at it, then probably there could be change. So if you give provision like from Malaysia or Singapore, he was telling, there are more PG seats and easily they can get than what you are having, because their undergraduate number is less. We are producing so many undergraduates, and at the end of our MBBS, they don't know anything. I have seen people are coming with all India merit. They are topping the merit, but they have not seen patients. So when I ask him, start an IV line, he says, sir, please help me. I have not seen a patient. I have only did the entrance. So this is the reality. We have to change. We have to give emotional contact with the students, and we should see the outcome and continuous assessment. I think that probably should help. This is my feeling.
Thank you, sir. So,
just to add on this peer learning, because I have learned all my anatomy, physiology, biochemistry, pathology, all from my friends, right? And they taught me so that I also got interested in teaching. So whenever they see me, they got scared, right? So this fellow will come and teach me something that he want to learn, right? So they will be really scared of seeing me because I have to read twice or thrice to teach someone. So they are very comfortable with, I am just comfortable with my friends, right? So all I know about middle ear is for one friend who made a model of middle ear from a skull, and he taught us everything, right? So I was really he was down to it near me so that I could learn better from him, right? So that I want students to be learning from their peers, so they don't have this cadre difference, right? So what I'm feeling is when I go up in my cadre, I'm a professor, when I become up in my cadre, that students come with me, right? Come to near me, right? So when I was an assistant professor, they had a lot of students, friends really. Now when I'm a professor, no one is coming near me, right? So they're really scared of me, and it's very difficult for me to go down because they don't want me to come down also, right? So I am ready to go down, but they don't want to come down. They're scared of coming to me. So thank you, sir.
Thank you. So we are.
I quite often give them the relevance of one class. 150 students. In the worst case scenario, relevance of one class, 150 students, in the worst case scenario, they will each one of them see on an average 10 patients a day, 300 days a year for 30 days. If you multiply it, it becomes 1.5 crores. So when we say this class, I am teaching you, but I am actually treating indirectly 1.5 crore patients along with. So that brings a peer-to-peer responsibility. And I reinforce with them with positive. Just imagine you are doing this class and 1.5 crore people getting treated through this 150 batch. And we don't give a negative feedback. We don't show them that there are 1.5 crore dead bodies. Only the positive outcomes will be out, and that clicks. I've used this analogy, I mean, so many times.
Thank you, sir. We'll take one short comment from sir here.
Yeah, I had an experience as a NEET supervisor examiner, how the students make use of these gadgets and use of this modern technology to their extent of not remembering things and not using as a learning process. They use as a get more marks and other things. That lady is having that Thali Sara. That in that she was having camera and seeing the MCQs, having a Bluetooth in the ear, she used to answer. There were CCTVs, we used to observe all the candidates and questions were in different models. One A is not there with her, B is not there with, so different. So when I noted that when we went there and stood there, she was just concentrating and answering the question very promptly. So we got tested her. Then we came to know that camera was hidden there, the ear Bluetooth was there. Such a misuse are made in even the exams also, application of mind also. So learning is importance to be given for the gadgets is for learning. So they can use misuse. It should be detected and it should be avoided. It's my experience as a NEET examiner, NEET supervisor.
Thank you, sir. So with this, we'll conclude the session like by final points that there are some challenges with this new generation of students, and we have shared a lot of methods to engage them during the classroom and outside of the classroom as well. Involving them more in the learning process is one of the important methods, and I hope we all shared a lot, and we will be having more to share with the network of the community that we have. We can share and learn from each other. With this, shall we close the session? Thank you. Okay. In attempt of increasing the attention span of students, teachers lose their lifespan.
Once in a lifetime.
So it should be like cats having 9 lives or something like that.
Thank you, Dr. Madhusudhanan, for such an interactive and informative session.
Thank you, audience.
And I thank all the panelists, Dr. NachiKet Shankar, Dr. T. Mahalakshmy, and Dr. Narendiran for their valuable inputs. And I also thank the audience for their active interaction, sharing their inputs, made this panel discussion a very interesting one. Thank you, everyone. Now I'd like to invite Dr. Renu G. Boy Varghese, Professor, Department of Pathology and ex-Director PIMS, to the stage to present the mementos to our resource persons now. And I also request Dr. Bobley James, Professor and HOD, Department of Orthopedics, Orthopedic Medical College, to stage to present the mementos to the resource persons of this scientific session. Dr. P. Madhusudhanan and Ponnusamy, moderator of this session. To Dr. NachiKet Shankar, panelist of this scientific session. I request the other chairpersons to join, panelists to join them. Now I request Dr. Bobley James to present the memento to Dr. T. Mahalakshmy, panelist of this session. To Dr. Narendiran Krishnasamy from Malaysia, panelist of this session.